Welcome, everyone, to the next installment of our series, Zoom into Healthcare Price Transparency. I'm Matthew Albright, Chief Legislative Affairs Officer here at Zelis, and I'm excited today to be joined by my colleague, Harin Bhatt, VP of Product Delivery. Harin has joined us to discuss the upcoming Schema 2.0 updates to the transparency and coverage requirements for those machine-readable files. And we're going to talk today about what those new updates mean for healthcare payers. So Harin, let's start with the basics. First, what is a schema, all right, this thing that's being uploaded, and what does that have to do with price transparency?
So the transparency and coverage regulations require health plan to publish machine-readable file, known as MRFs. These are huge data dumps of negotiated and out-of-network rate. And in order to standardize all these data across many payers, the Center for Medicare and Medicare Services, CMS, came out with a sub-regulatory guidelines on how the data should be organized. These guidelines on technical format are called schema. What is new is that CMS announced in May that they're coming out with a new schema that health plan need to follow, and that the new schema is called Schema 2.0.
Gotcha. So this new technical formats, this new technical formats for the MRFs. When do plans have to make sure that their MRFs comply with this new schema?
So the Schema 2.0, as we said, is the new technical format for MRFs under the transparency and coverage rule. CMS says it will finalize the Schema 2.0 by October 1st, 2025, it's a few weeks away, and enforcement begins February 2nd, 2026, which leaves very little time to build and roll out. So developers will only have a few months to ensure the systems can handle the new format.
Gotcha. So important dates there, October 1st, when CMS is rolling out the new format, and then February when compliance starts. And what are the key changes we're expecting in this Schema 2.0? What do payers need to think about?
Sure. So per CMS, the updates were really meant to improve data clarity and efficiency, making it easier for plan to comply, but also for consumers to access accurate information from MRF. While the earlier focus up until now has been on how provider group data and service codes will be reported, they will reduce file size and streamline compliance. CMS has also proposed a few new additional attributes recently to improve usability of MRFs. Let's talk about some of these changes, starting with provider groups. So provider groups had 3 ways of being referenced. CMS is reducing that to a single way that provider group can be referenced in the MRF, with the goal of streamlining the MRF file, the schema, and overall reducing the file size. There's also a new custom place of service code called CSTM00. Again, the goal here is that if the providers are doing service at multiple locations but the same rate, just define it once, do not repeat the data. Table of content, or TOC, will be required when multiple plans share the same negotiated rates. We know that many plans have table of content, but we also know many plans do not have table of contents. So we can help there. As well as a few new attributes such as network name, business name, plan sponsor name, version information, last updated date, and severity of illness attributes. Really, all of these attributes should together reduce file size, but more importantly, overall improve the accuracy and efficiency of MRFs, because now they will have meaningful data.
Very good. It sounds like lots of different changes coming on there. And also, Harin, you mentioned the accuracy and maybe the file sizes will be smaller. I can't wait to catch up with you in a couple months to see if that's exactly what's going to happen. But how is Zelis then helping payers through this transition?
Sure. So Zelis is committed to making this transition as smooth as possible. We have a vast experience implementing both transparency and coverage 1.0 requirements, transparency and coverage 2.0 requirements for many of our clients in the last few years. Our platform S365 will be Schema 2.0 ready. We're closely monitoring CMS guidelines for full alignment. Our MRF creation and hosting tools will meet the new requirements, and our expert team is here to help clients assess their readiness and stay ahead of compliance deadlines.
Good. So right now, looking forward, Harin, what should payers be doing to prepare?
Really start by engaging with Zelis to assess your current readiness. begin prepping for Schema 2.0 and make sure you're aware of key dates. Really, October 1st, when Schema will be finalized, and February 2nd, when the enforcement goes into the effect. Early preparation is the best way to avoid compliance issues.
Excellent. So October, rollout, February compliance. And can you more broadly explain the Zelis data service solution that you all have for transparency and coverage?
Absolutely, Matthew. Zelis really has three key components, starting from creation of MRF, hosting of MRF, and consuming MRF to power the S365 platform. With creation, we can help plan create in-network and allowed amount MRFs that are CMS compliant. With MRF Hub, we can take those MRF, we can aggregate those MRF, we can archive those MRFs, and we can create that very complex mapping to create that table of content, which is also required by CMS. Lastly, our MRF rates solution, rates manager solution, takes the data and creates the end-to-end data management for mapping the MRFs for member-facing visualization. And this is really important because MRFs themselves are not network specifics. So a member doesn't know what MRFs to use. MRFs are group specific, which means there could be hundreds of MRFs, even if there's only a few networks that plan has. And our MRF rates manager can create that complex member to the account and account to the MRF mapping, really leading to compliant and accurate results. These services altogether help our clients meet the CMS transparency and coverage requirements for both publishing and consuming MRF efficiently.
Sounds like a very comprehensive suite of solutions, and it sounds like moving mass amounts of data. This has been very informative. Hiren, any final advice for our listeners?
Yeah, really stay proactive, engage with our team. Our team has a vast experience in handling the transparency and coverage, both 1.0, 2.0, and now Schema 2.0 requirements. We have expertise, we have tools, we have processes. So please reach out to us, stay engaged with us.
Very good. Thank you, Hiren. And thank you to all of our viewers. We're all going to keep an eye out for finalization of Schema 2.0 in early October. Before then, for more information about price transparency or to get started on this, reach out to your Zelis representative today. Thank you all.
Thank you.